Thanks for having us. As the introductory person said, I'm Susan Wenker, and I'd like to also offer Dr. Kahili a moment to introduce himself. So go ahead, Hossein.
Hello, everyone. So Hossein Khalili, I'm the Director for Center for Professional Practice and Education at the University of Wisconsin-Madison, working with Sue and colleagues.
All right, thank you. And so as Hossein noted, there is more than just the two of us who worked on this project. And so we're appreciative of everybody's collaboration. So we're going to talk about the Telehealth Dementia Caregiving Micro-Credential for Interprofessional Health and Social Programs, how that was developed, and then what it ended up being. So our learning objectives for today's session is to describe the current state of interprofessional dementia caregiving trainings in Wisconsin and the U.S., and also state how the Interprofessional Dementia Caregiving Telehealth Community Practicum Badge curriculum was developed and piloted.
So this is slide for me. So this is part of the work that we do at the university, or UWCIPE, and UWCIPE is a center that is affiliated by the Provost Office, as well as the for Health Sciences at the University of Wisconsin-Madison. You can see School of Medicine and Public Health, Nursing, Pharmacy, Veterinary Medicine. At the same time, we're working with occupational therapy program, as well as social work plus others. Next slide. And as for the center, so the main goal is to bring interprofessional education and practice more intentionally in the curriculum of health professional students. So through our mission and visions, really, we have created a number of different initiatives at the right side of the screen you can see. And one of these initiatives is IP Health Aging initiatives that this project is about. And this project is also in collaborations with the Department of Health or Health Services in Wisconsin. And one more thing before we go to the next slides. This project is a part of the Badger program as well. So we have created digital badges to award the students who complete some IP initiatives. And for this specific telehealth students who complete will receive the IPL Dementia Badge.
All right, thank you, Hossein. So these were some of the issues that we addressed when we were first thinking about partnering with the Wisconsin Department of Health Services. So we recognize that dementia is a public health challenge and that it affects over 50 million people globally. There's a rapidly growing population and decline in dementia care specialists. The existing unrecognized crisis in dementia and mental health care will worsen. The integration of interprofessional team-based care in healthcare education and practice is an effective strategy in improving health outcomes of people living with dementia. And then additionally, although interprofessional teams are not new to geriatrics and gerontology, the current evidence shows that a lack of understanding of the nature of and scope of practices among healthcare professionals causing a lack of interprofessional collaboration does exist. So caregivers experience gratification from caregiving and can experience financial, social, and psychological stressors. These multifaceted issues require an interprofessional team of health professionals educated and trained to work together to assess and address caregiver needs. Yet often, healthcare professional students are trained in silos. So as Hossein alluded to, there's Interprofessional Dementia Caregiving and Interprofessional Learning Badge initiative that was also part of this. And the primary goal was to develop, pilot, and implement an interprofessional practice learning badge initiative to educate health profession students to learn and work collaboratively with people living with dementia and their caregivers. The IPL initiative is a 3-year telehealth community placement project funded by the Wisconsin Department of Health through the Wisconsin CDC, funded Building Our Largest Dementia or BOLD Infrastructure for Alzheimer's Disease project. So there's several layers that collaborate together and receive this funding. So to get the curriculum developed, we'd had several components. One of them was a scoping literature review. We went out and determined what the current programs for caregivers of people living with dementia were available, if they were online or reading material, videos, etc. This then helped us facilitate understanding the mode of delivery for the caregivers of people living with dementia. that are current and where the need was. And then it also provided us resources for students, and they're listed here. ARP you may be familiar with. The ADRC is the Aging and Disability Resource Centers, which are located in our particular state of Wisconsin, and then publications and videos. In addition to the scoping literature review, we also did interviews. We worked with interviews of caregivers themselves, because our caregivers actually ended up becoming the instructors, dementia care specialists, community leaders, and then diverse populations. So we tried to get many voices as we could to understand the cultural differences that exist and to better prepare professional students for working with folks. So the badge itself, again, we understood that there's a critical gap in providing interprofessional education to health and social care students related to the health and well-being of family caregivers of people living with dementia. So not just the person living with dementia, but the caregiver of them. Despite the growing dementia care curricula in the U.S. that we identified, the interprofessional dementia caregiving curriculum is still lacking. So to address this important educational need, a multi-phase approach was used to develop, implement, and evaluate a customized micro-credential curriculum, which we called the Interprofessional Telehealth Dementia Caregiving Community Practicum Badge. Hossein?
Thank you. So after we did it all, the letter review as well as talking with the planning team, so we plan to pilot the project. Sorry, next slide, if you don't mind. So for the pilot projects, we recruited students across different professions. We had 5 interprofessional teams, and each team included of 1 caregivers, real caregivers who was caring for patients with dementia. We had between 3 to 5 students, in an average 4 students from varying health professional disciplines, from medicine, nursing, pharmacy, PT, OT, and social work. We have 1 dementia care specialist who has been connected with the caregivers part of the team, and plus, we have had 1 facilitators. So usually we're faculty facilitators. Sorry. Go to the next slide. For the pilot, maybe. For the curriculum, and as we went through the literature review as well as all the works, we came up with this component for the pilot that was considered as the curriculum. Pre-work, so we knew some students were familiar with dementia and dementia caregiving, some others not. So we have had 2 to 3 hours of pre-work. The students learn more about dementia caregiving as well as the community resources available to those patients with dementia as well as their caregivers. Then we hosted a 1-hour orientation, which is virtual, in which we introduced teams with their dementia care specialists, facilitators, as well as themselves. And the rest, which is about 8 hours, it was the actual placement. So part of the placement, we have had 2 virtual home visits with the patients with or the caregivers of patients with dementia. Also, students met with the ADRC as well to know the resources available. The purpose of the first virtual home visit was for students to assess and interview the caregivers of dementia to find out what's the needs and the resources that they are looking for. And then they would work with their team facilitators as well as the DCS to develop a customized community resource package in order to present to the caregivers. The final visit, so students, teams presented their package as a capstone project to the caregivers. And after receiving feedback, they would go back to their team and revise it and submit it as the final submissions in order to receive the badge. And also we have had a debrief with the students as well as DCS and facilitator. For this pilot, we did a number of different, feedback review as well as evaluation. So as we're talking, so the curriculum was initially created based on the lit review. At the same time, before we piloted, we also wanted to check the components with the DHS as well as caregivers and DCS. And they provided great feedback, and we were very good with the final curriculum for the pilot. The evaluations included DKAS, Dementia Knowledge Assessment Scale, to see the knowledge of the students, how it could be impacted by the curriculum. So we did a pre and post for all the components, including the DKAS. Interprofessional socialization and valuing skills, the 21 items, so it was used as the other. And the last skills, we used assessments of interprofessional team collaboration skill. You can see two major components. One was the dementia knowledge, and the other is the interprofessional education and practice component for the evaluation. The good thing, so when we did the assessments and all the pre and post evaluation, we found out that there's been significant improvement in the students' knowledge regarding to dementia. So the pre-test, the mean score was about 12.76 out of 25. That jumped to 22.5, almost doubled as they went through the dementia caregiving batch. The ISVS, or interprofessional socialization, also shows significant improvement, so from 5.89 to 6.41. For AITCS, or assessments of teamwork, it was increased, but it was not significant. Still, we saw some improvement in specifically coordination of care for the caregiver. And then the other most important piece for us was to hear how students really like the opportunity in many different ways. One, just through talking with the caregivers. So it's not one of the comments here on this slide, but we receive students that really liked, working with caregivers as the co-teacher in this situation. At the same time with the dementia care specialist, they really like, to have the dementia care specialist on the team that they can reach out for any questions and support. The other piece, that we learned that students really enjoyed collaborating with each other and learning and applying the knowledge in other contexts. A few of the students, they utilize what they earned or they gained, through this pilot into other placements that they've been working part of their program as well. That was very rewarding for us. And all the students received their badges. And for us, at the centers and in collaboration with DHS, we are continuing the work. So our publications or paper is going to be published, has been accepted, the results of the pilot. And also we have done, in addition to this presentation, number of other presentations at the national, international levels. We have received, in addition to students' feedback during the debrief, we received a number of great other feedbacks for the improvement as well. We are working on all the feedback they receive to improve. So I think, all the revisions are almost being done, and we are in the process of planning for the next implementation of the curriculum. So we already have about 25 students registered, and we are looking for maybe 10 additional students to be part of the implementation. Our implementations, is going, or the next implementation is going to be from February to April. So the similar to pilot, so we have 12 hours over 3 months. So last year it was February to April, and this year is going to be, or the 2023 is going to be from February to April, and the students with their team over the 3 months works through the 12 hours of the project. So I think that should be it. So anything to add for the pilot or the next step?
No,
so
I think
I
was just going to add, I think the only thing I was going to add is the real key for this was that the caregivers were the teachers for the students, and everybody else supported their caregivers and facilitated that teaching moment for them. So I think that was also a unique piece to this relative to that it was a telehealth, and in addition to the badge, a lot was from the caregivers.
Thank you. So we're open to any question, comment that anyone might have.